Okay, hit me with your questions. What questions do you have?
Corby, I had a question about the meds that are on, like, listed on our, that page, I guess, where it's going to be on the test. For all those meds that we need to know, do we need to know, like, the drug card level on all of those medications, or how in depth do we need to know those meds?
You'll need to know, yeah, probably, like, you need to know the classification, you need to know what it's used for, things you would teach about it, the side effects. But if you know what group they're in and you know that stuff about the group, then you're covered both ways. Does that make sense? Because I can ask, yeah, you can be asked about a group, like, for example, you could be asked about NSAIDs in general, or you could be asked about, like, ibuprofen.
Gotcha. Okay, thank you.
Uh-huh.
So with that, do you want us to know, like, all the contradictions and stuff too?
Yeah. Okay. Yep, you need to know contraindications. Now, I know if you look up in your drug book, especially in your drug book, it'll have, like, some meds have like 20 contraindications or 20 interactions or 20, plus side effects. Like, you really should just know the most common ones and, like, specifically the ones I go over and the ones that are, like, noted in your book.
Okay, got it.
Helps.
So would you say more go off the PowerPoints or go into depth in what we can read in the book?
I would honestly read both of them.
Okay, but the majority would come from the PowerPoint?
Yeah.
Okay.
Yeah, there were a few students last semester that didn't even open their book, and they did just fine.
Okay.
But it also depends on how good of a memorizer you are.
Yeah. So
and how you study.
So if we have the older edition of the book, how much has it changed?
Oh, that's a good question.
Pretty big.
I don't know. I don't have an older version, so I can't compare.
Okay.
I can't imagine that they would change a whole lot. I mean, especially with older meds. I mean, nothing's really going to change with them.
Okay. Awesome. Thank you so much.
Mm-hmm. Oh, okay. Thanks, Megan. Yeah. Page numbers might be different. They might have maybe added in a few newer drugs. But I think as far as the old information, it doesn't really, it doesn't change. Any other questions?
I have a question about.
Go ahead.
What was that?
Go ahead.
Oh, I just had a question about the method of action for the anti-inflammatories. Is there any other method of action besides them being the cyclooxygenase inhibitors?
No.
Okay, sweet.
Yeah, they inhibit that to inhibit the development of prostaglandins. So. I did want, a lot of you have turned in your assignment, which is fantastic. And I went through and looked at all of those and graded them. One thing I wanted just to point out real fast is that sumatriptan, that's Imitrex. That's for headaches. That is not an opioid. Like 90% of you guys put it on the list under opioids. It's not an opioid. So don't study sumatriptan under opioids. It's different.
What was the other one that went in that box under the opioids? If that wasn't one of them.
So let's see. So I know I didn't really explain this very well. It's really hard when we didn't have a lecture, but you guys did very well with it. So the boxes that were kind of grayed a little bit, those were supposed to be prototype drugs. So like morphine would be the prototype drug for opioids. And then underneath that, I had codeine, fentanyl, hydromorphone, meperidine, oxycodone, hydrocodone, and then methadone. So those are the partial opioid agonist was tramadol. And then the mixed agonist and antagonists were the pentazocin, the buprenorphine, and then the albuphine. So you guys did very well. Also, another note, black box warnings. Black box warnings are for things that are life-threatening. Constipation is a huge side effect of opioids. It's not necessarily life-threatening. Bowel obstructions are. Constipation is not life-threatening. So the black box warnings for opioids is the CNS depression with the respiratory depression with that. And then they do consider dependency a black box warning. So those are your two black box warnings with that. Constipation is great side effect, and it's important to watch for and to help prevent. But the black box warnings are more life-threatening. Yeah, Shelby, so like addiction. Yeah, you got it. So, but I'm very proud with the lack of instruction. You guys did really well. For the opioids, the CNS depression and addiction. Seizures, that is more with tramadol, specifically with the SSRIs. Not necessarily with all the opioids. So yeah, remember that with the tramadol with the SSRIs, because the tramadol helps with the mu receptors a little bit, and it increases the serotonin, which also helps with pain as well, which is why SSRIs are one of the adjunct therapies, right? Okay, yeah, Mark, I certainly can. Let's see, let me find the slide I have for that. Let's see, where do I have that? Sorry, give me 1 second.
Attention, please. We are going to be testing the fire alarm. The fire alarm will be going off.
Oh.
Do not evacuate the building. And we will be testing the fire alarm. Do not evacuate. Thank you.
I apologize. Did you guys hear that? The fire alarm. I apologize. If you guys hear that in the background, which you probably will because it's kind of loud. Okay, where did we talk about that? Okay, here we go. Got my slide. Well, I don't know how. Anyway, you guys can see that, right? So, okay, so non-specific and non-selective. So non-specific is multiple receptor sites, but the same receptor. So we kind of talked about the mu, how we have mu receptors in our CNS and in our gut with our intestines and stuff. And so that's why opioids, they are non-specific. They hit the mu receptor, and we have those in multiple sites. So that's going to affect like our eyes with the constriction with our eyes. That's why when we overdose, you got the pinpoint eyeballs. Constipation, because we have mu receptors in our gut and in our CNS. So then we get the respiratory depression as well, right? So then non-selective are multiple receptors also in multiple sites. So like with opioids, they just do the mu, some kappa, some delta, but mostly mu. Epi does alpha 1s, beta 1s, and beta 2s. So it has multiple receptors in multiple sites. Does that help? So non-specific is like one receptor, wherever that receptor is. Non-selective is multiple receptors, wherever all those receptors are. Mark, I hope that helps. I have a hard time kind of keeping them straight too. But looking at this slide again and maybe kind of going over kind of comparing and contrasting like opioids versus epi, because epi does 3 or 4 different receptors everywhere, and opioids, they just kind of focus on the one. Antihistamines too. They just do the histamine receptors in all the different places.
Hey, Corby, I have a question regarding the prostaglandins.
Okay.
Do we need to know all of those, or do we just specifically need to know a few, like the COX-1 and 2? Or,
yeah.
Okay.
So the COX-1 and 2, let me show you. Okay. So the COX-1 and 2 aren't necessarily prostaglandins. They take the arachidonic acid and turn them into prostaglandins. Now, this list of prostaglandins, this is honestly a really small list. And this is just to kind of let you know that these are some of the most common prostaglandins, but you're not going to be asked about them specifically. Does that make sense? You're not going to be like, substance P, yada, 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 yada. This is just some of them. These are what they do, which contributes to the inflammation. So if you stop the prostaglandins, you're going to stop the vasodilation, the relaxation of smooth muscle, the increased capillary permeability. So it's going to help with the inflammation. It's going to help make it worse, and it's going to help make it better. Does that make sense? So, and then just
That makes
remember,
sense. Awesome.
yeah. So the COX-1 and 2, these are enzymes that take the arachidonic acid and turn them into prostaglandins. So if you stop these enzymes, you're going to stop the prostaglandins from being produced, which is why NSAIDs work so well.
Which ultimately would stop the inflammation.
Uh-huh.
Okay. Okay. Thank you. Awesome.
Yeah. And you have to understand that like ibuprofen and naproxen, they're COX-1 and COX-2 inhibitors, where the celecoxib is only COX-2. I just had a brain fart just then.
You said ibuprofen and naproxen. Is that what you said? Okay. And they're COX-1 and 2 inhibitors?
Yeah. They're COX-1 and COX-2.
Okay.
They do both. And then the celecoxib, what makes that one kind of a choice over the other two is that this only inhibits the COX-2. And so the COX-1 messes with the stomach lining, and that's why, like the ibuprofen, naproxen, aspirin, that's why they irritate the stomach so bad. The celecoxib leaves the COX-1 alone, just targets the COX-2, which gives us the anti-inflammatory, but protects the stomach as well. And then, as you guys all put on your paper, celecoxib also has a black box warning with the increased blood clotting and risk for CV and MI and strokes. So it does come with its own list of disadvantages, but the advantage is that it leaves the stomach lining alone, so you don't get that upset stomach and the risk for bleeding with that.
I had a question about in Unit 2, the classifications of the pain medications. So just to clarify, like I've got non-opioid and opioids, and then NSAIDs go into non-opioid, and acetaminophen does too, but it's not an NSAID, right?
Correct. Yep.
Is there any other classification, or was it just kind of the non-opioid versus opioid?
Yeah. So if you look at, let me just show you. We're packing up and moving to the new building tomorrow. So I have everything packed up. But here's this one. This all filled out for those who haven't done it. So if you look on this that you just did, or that you will do tonight, you have your opioids, and they're kind of split up into like the mixed agonist, antagonist, the partial opioids, and then the full opioid agonist, right? And then you have the non-opioids, which is split up into your APAP, right? Your acetaminophen, and then all your non-steroidals, which are then split up again. Really, you don't necessarily need to know that like ibuprofen is a propionic acid. You just need to know the mechanism of ibuprofen. Does that make sense? So really, the mechanism
like
of
need
action,
to know it's an inhibitor for the COX-1 and COX-2. That's what we need to know.
Mm-hmm. And then it's an NSAID, yeah. But as far as like the pharmacological classification, that's not specifically tested on. I mean, it's good to know, but
Thank you.
yeah, I hope that helps, Lizzie. So Maddie, I'm trying to explain it. So you need to know, like obviously you need to know about opioids, that classification. You need to know about NSAIDs, that classification. Tylenol is kind of in its own little classification of non-opioid. And a lot of those things overlap. Like, you know, with all opioids, you have.
Attention. We will be testing the fire alarm systems again. Do not.
Sorry about the interruption.
We will be testing
So, for example, with almost all opioids, you have like this the respiratory depression, constipation. If there's any specific drug questions, it's going to be one of those need to know drugs. So, know about the group of drugs and then kind of hone in on those specific drugs.
So
Okay.
we don't need to know if it's a pure or mixed opioid agonist or antagonist. Do we need to know those with the mu and kappa receptors?
If they're on your list of drugs, like I said, we're moving, so everything's packed away.
No, you're fine. On the slide, it characterizes morphine and codeine as a pure opioid agonist. Would we need to know the classifications of those and the specific drugs listed? It's on slide 26 on the analgesics.
This one?
Yeah.
Yeah.
So to know those ones.
If these drugs, I think buprenorphine is on that list. So you'll need to know that it's a mixed opioid agonist.
Okay. Awesome. Thank you.
Okay. Yeah. So if it's on the drug list, definitely know. And then understand what because if it says this drug a mixed opioid agonist, you're gonna want to know what that is. Does that make sense? Like so there's some questions throughout the course. Okay, for example, there's some questions throughout the course that will say, so you're gonna give this drug, and let's say it's like hydrocodone. We didn't necessarily go over hydrocodone, but in parentheses it says an opioid. And then it asks the question about that, even though you don't, like maybe you haven't ever heard of that and you're like, we never went over this drug, but I know about opioids because we talked about opioids. And focus on that part. Does that make sense? So if there's drugs that we've never talked about, there's going to be something else in there, some kind of classification, or it'll say this drug treats this and this and this. Then go off of that. Does that make sense? Don't get like strung up on, we didn't talk about that specific drug. We might not have talked about that specific drug, but we talked about that classification. And so if you know about your classifications, then you should be able to answer the question.
I do have a question kind of going along with that. The sumatriptan, so that's getting classified as an opioid, even though it's like an anti-migraine? Because that was one of the need to know drugs and it's listed under opioid.
In the book or in
both?
My PowerPoint.
I didn't see it in the PowerPoint, but you have it listed as like one of the starred medications to know. And then
is that the SSRI?
Correct.
SSRA?
Yeah. Actually, I think it's an SSNRI. I don't know.
Hold on.
But I didn't think it was an opioid, so that's why I got confused.
Yeah. Hold on.
It's on slide 61, if that helps, Corby.
Yeah, I see that. Let's see. I think this therapeutic right here where it says narcotic analgesic, I think that is wrong. And that is my bad. Obviously, because I made the slide.
So we do need to know about the medication, but it is not an opioid. Is that what I'm understanding?
Yes. Yes, you'll need to know because it's this it's the serotonin agonist at the 5-HT receptor. That's what it is. It's not really a narcotic analgesic. It's not a controlled medication. So I'm sorry, that is a misstep.
That's okay.
But yeah, it's as far as I know, it is not controlled. It's not considered an opioid. It is an anti-headache medication. It's really good for migraines.
So then just to confirm that on our paperwork, the partial opioid agonist is tramadol, right? Because it's a partial opioid, partial anti-inflammatory kind of. Okay, yeah. Awesome. Yeah. So that's not sumatriptan.
No, actually, sumatriptan's not even on this page. I kind of left the headache stuff off.
Okay, so okay.
Yeah. So sorry about that. I will change that on my slides. If you guys just want to cut off or cross out that narcotic analgesic, that's wrong. I apologize for that. The therapeutic class would be a headache reliever. Do you guys have any other need for clarification or any other questions that I can help you with? There we go. I changed that on my end. Sorry about that. And if just for future reference, if you guys see anything else like that that's like confusing or maybe misspelled or something like that, please let me know. So yeah, so for the math, when you're doing the weight, so what you guys need to do is, so like let's say, let me get my calculator so I can. Okay, so for example, so like say a 60-pound kid, right? So you're trying to figure out how many kilograms. You're figuring this, whatever it is, this dose out for a 60-pound kid. So you guys know to take 60 and divide it by 2.2 to find the kilograms, right? Now when you do that in the calculator, it comes out 27.2727272727, on and on and on. So what you're going to do is you're going to take that 27.27 infinity and change it to 27.3. Okay? And then you're going to just clear out your whole calculator, right? And your weight from now on is 27.3. So then you can put 27.3 times whatever the dose per kilogram is, and then that's your dose of medication. Don't leave that 27272727 in your calculator and just continue on. You got to clear it out, round it to the 10th place, and then continue with your calculation. And then that'll get a lot of ranges. And when it asks for ranges, it should get your ranges right on. If you round to the 10th first, clear out your calculator, and then continue on. Yeah, you're welcome. No problem. And guys, if you want to go over some problems or if you have any questions, you can call me, text me. I'll be in the office today, tomorrow, and Thursday. We can even do like a blue button conference. I did that with Olivia already, just one-on-one. So I'm here to help if you guys need help. Don't be afraid to ask me. I want you guys to pass this test and like get it behind you so you can move on.
Thank you, Corby. I appreciate it.
Yeah, no problem. Hey, yeah. Yeah, like I said, if you guys have any, and I'm going to say it a million times, but if you guys have any problems or questions, just let me know.
I had a question really quickly. Just I was curious about with the math test. Did you guys do like you took out any questions if a certain amount of us missed it, or did you guys not do that with the math test?
Yeah, so we didn't do that with the math test. The math test is kind of void, null and void with that. But we will do that with the rest of the farm tests. If they're starting low, or if, like if 90% of you guys got it wrong, we're definitely going to throw it out. As far as the math, you either did it right or you did it wrong. That's more of a calculating thing. But we will do that with the rest of the tests. And then, like as with other classes, we'll let you know which ones were dropped and stuff like that.
Were there a lot of people that missed those questions due to the rounding with the weight in kilograms?
There were quite a few, but not everybody. I don't know if that answer even helped.
Thanks. Yeah, just curbing my curiosity. Thank you.
Yeah. And then just so you guys know, I'm really, like, you guys are great and you are a really smart bunch. But if this next farm test, because it's the first one, I know a lot of you guys are a little stressed about it. Don't get crazy discouraged if you don't do super great on it, because farm is really going to test your study abilities. Okay, so it's a lot of memorization. It's a lot of remembering, honestly, and kind of putting it together. Because if you know that opioids cause constipation, what are you going to teach your patients, right? How things to prevent constipation, stuff like that. So it's kind of putting things together, and it's really going to test your testing abilities, and you might have to switch up the way that you test, or the way that you study, not the way that you test, but the way that you study things. If you're normally a binge and purge type person where you just study the night before, that might not work anymore. You might have to study a little bit each day to help you remember things better. If you might figure out that you're more of a flashcard type person where you haven't really needed flashcards before, just stuff like that. So this will really kind of help you discover what kind of a study person you are, if you don't already know. Do you guys have any other questions? Anything else that I need to clear up? I know last week was a little crazy, and then the narrated PowerPoints, I'm not very good with those, so.
I just have a quick question.
Yeah, go ahead, Megan.
Like the practice questions and the PowerPoints and everything, is that the same way that you write your test questions?
Some of them are, like some of them are straight away, like what's the mechanism of action of an NSAID, right? So they're just straight away. Others are, so your patient is doing this and you give him that, what do you expect to happen? Or, you know what I mean? It's more, I wouldn't say problem solving, but it's more, they're more like thinking questions.
Okay, thank you.
Does that help a little?
Yeah.
A little?
Yeah, I just felt like the practice questions were easy to understand, so I just wanted to make sure that like I wasn't going to get tripped up on the test or anything.
Yeah. So just read the answer or read the question, figure out what it's asking, and then answer it. And try not to rush through it. I know there's a time limit, but if you really kind of take your time and don't rush through it, you guys should be good. So anything else? Okay, so I'm available here in my office till 4. So feel free to call me, message me, and then good luck tomorrow. And if there's anything during your studying, if there's any questions, just feel free to shoot me a text. If it's after office hours, you might have to give me a hot minute to respond back, but yeah. Anyway, good luck. I'll see you guys tomorrow. Have a good day.